And I'm pleased to be joined now from the Cornwall Community Hospital, Dr. Raynor. Welcome to the show.
Today, thank you for having me. I appreciate the opportunity to talk about Seamless.
It's great. Yes, it's great to have you here to talk about this exciting new initiative at the Cornwall Community Hospital. But before we dive into that, let's introduce yourself a little bit to the community. Talk about a little bit about your background.
Certainly. I'm an orthopedic surgeon here in the community. I've been practicing in Cornwall. I think I'm going into my 13th year. I have a general orthopedic practice, but I specialize in sports medicine, so that's about 50% of my practice. I'm also the founder and the co-owner of Human 2.0, which is a rehab, physiotherapy, and movement facility in Ottawa, which is where I live with my spouse. And then whenever I have free time, I'm also a content creator for YouTube.
Wow, quite the resume, quite the experience as well. So it's always interesting to talk to someone with that background and expertise. So let's talk a little bit about SeamlessMD. It's pretty well new to the Cornwall Community Hospital. I think it debuted in January. But talk to me a little bit about what it is and how it works.
Excellent. So we've been working on it since January. It's actually just debuting now. So, the first couple of months was spent just doing the legwork to get this program up and running. And Seamless is a software application platform which is basically a patient outcomes management tool. And so it sounds really complex. It's a lot of big words, but what does that mean? So it's an application that helps us to communicate with patients, track patients' progress following surgeries, and allows us to communicate with them to provide important information that they need for their postoperative care in a very timely, succinct manner to help optimize their recovery and to improve their surgical outcomes after following a procedure.
Oh, that's fantastic. So talk to me a little bit, what that sort of means or works for the patient. So when they're using the app, how it works for them and sort of information that it provides.
Certainly. So normally when a patient goes to have surgery, I would give my patients a stack of papers, preoperative stuff to prepare them for their surgery, to tell them about what to expect and what kind of things to have ready. And likewise, following surgery, we would do the same thing. We'd give them a stack of papers, and they'd have to read through it and try to figure out exactly what to do when and what things to have. With Seamless, we now have an application that compartmentalizes and automizes all of that. So rather than handing them a stack of paper, we basically sync them up with the app. The app knows when they have their surgery, what are the things they need to do prior to surgery, and what are all the things that they need to do afterwards. And so the application will communicate with them. It will prompt them in advance. Oh, by the way, do you have your crutches ready? Do you have your brace ready? Have you taken this medication? Have you stopped your blood thinner? So it'll do all those things before surgery. It'll help to give them directions to the hospital. It'll tell them what time they need to show up on the date of their surgery. Following their surgery, it will remind them of all things. Have you gone to pick up your prescription? Have you taken your pain medications today? Have you taken your blood thinner today? Have you done your exercises? What exercises have you done? Are you feeling pain? It allows us to record responses from the patient so that we know, if they're following the normal postoperative course, or if they're failing to meet the preordained metrics that tell us how people are doing. And in the event that they do give a response that is not what we are expecting, as surgeons, we will be able to see on our dashboard, oh my goodness, this person has a red flag today. And we'll be able to see that before they've even reached out to us. And using that information, I can then have my secretary or my assistant reach out to them and call them up and say, hey, Mrs. Smith, we saw that you were having trouble with your pain for the last 2 days. What's going on? Tell us, what troubles you've been having with your pain, with your analgesia. Have you tried doing X, Y, or Z, or is this medication not working for you? And so we're able to provide the information that they need in a timely manner, by the portal, but they are also able to communicate back to us, and we are able to see it. And hopefully we are able to act proactively to improve any problems that may, to deal with any problems that might arise, rather than dealing reactively, waiting for something to happen or waiting for them to show up and emerge after, they've had a problem.
Oh, that's excellent. So it sounds like Seamless is certainly an app name for the app, because that's what it makes the process, right? So talk to me a little bit about the reception you've gotten so far. Obviously, it hasn't, or it's just launching now, but I'm sure many of your colleagues are really excited about this coming to Cornwall Community Hospital.
For sure, we are piloting this application, or this platform in the orthopedic surgery program, and then also in the general surgery program. And I know for certainly in the orthopedic group, we are all excited about it. I haven't spoken directly to any of the general surgeons to see what their what their level of anticipation is, but just from a general surgical point of view, anything that allows us to communicate better with our patients and improve their outcomes, and to minimize the chance of post-operative complications, anything that does that and can be used easily by the patient, that's going to be beneficial, and we're all going to be excited about that.
Oh, absolutely. And we certainly look forward to following up on this and seeing how this pilot goes. But it really is exciting for the hospital and the community. Is there anything else, Doctor, that the community should know about SeamlessMD, or patients should know?
Well, any patient who's in the Cornwall Community Hospital catchment area, they're having an orthopedic program or a general surgical, orthopedic surgery or a general surgery being performed in the near future. This is certainly something that you should inquire about with your surgeon, and ask to get involved, because the more feedback that we can get from patients once we've implemented this program, the better we can sort of refine it and make it even better at improving the surgical outcomes for patients.
Absolutely. Yeah. What a great project and opportunity, again, just to make life easier, both for the staff and the medical staff, as well as the patient. So I want to thank you, Doctor, for your time. We know that in your profession, it's always busy, so we appreciate you taking the time to talk to us about this today. And like I said, we certainly look forward to the launch and continued following up on the progress of SeamlessMD. So thank you once again, and best of luck.
Not a problem. Thank you very much for having me. I greatly appreciate the opportunity to talk about it.